Welcome again. Let's take a look at the AnyLogic model for the Hipkins Hospital surgical workflow. Very busy, obviously, but let's see if we can pick through it. So there are two tracks, and they're identical. So patients are generated here uh, according to a Poisson, actually according to a. Um, let's take a look at the detail on that. So they arrive every 90 minutes, normally distributed with a small standard deviation here. I think of or is it 5 minutes? Yeah, so every 90 minutes, essentially, they're coming in. We click the timer, the stopwatch, at that point, timer A, and that is going to be ended back here after their surgery is done. Right, so they come in, there's a registration process. The person providing that registration service comes out of a registrar pool located here. And in the base case, there are two registrars, okay? Well, actually, that's a parameter that you can specify, but in the base case, there are two. We'll look at the base case in the next clip. So maybe we should just note that this section here shows all of the parameters, and you can set them by going to simulation main. And actually, I want to not click on that. I want to click on the hip hop main, hip hop version 2. And so you can see that you can specify, for example, the number of patients that are going to be scheduled in track A and B, and then the number of registrars in the pool, the interarrival time, mean interarrival time for track A of patients. That's going to be typically 90 minutes in the base case. Same for B. The time to register patients, their mean and standard deviation, the number of ORs in that are dedicated to track A and B, and then in the pool of ORs possibly. But let's sort of dive back in here. So there's a bunch of parameters. And so once the registration, the patients here line up, wait their turn, most likely they're just going to sail into the registration process, get registered, and then they line up again. But again, hopefully it's not going to be a long wait to grab an OR. And then so they pulling here from the first pick would be to get an OR out of track A if there are any available, and subsequently as a sort of a second choice would be to go after an OR in the pool. Right, then they grab an anesthesiologist, picking from track A's anesthesiologists, and then subsequently the CRNA pool. They get sedation. That includes all the pre-op prep and the sedation, and there's a delay associated with that. Then they wait for a surgeon, and the surgeon is grabbed again. Primarily, first choice would be to get one from the dedicated surgeons for track A, and then subsequently as an alternative from the PA pool. And then surgery commences, and it runs 100 minutes roughly. After that, we release the anesthesiologist, we stop the stopwatch, and then the patient heads off to recovery, discharge, maybe transfer to the hospital, depending on the situation, medical situation. But the ER then waits for an EVS staff member to come in and basically ready the OR for the next patient. So all of the EVS staff are in the pool. Same with the registrar, right? There are no dedicated registrars for each track. Same situation for the EVS pool. Once they're done cleaning the OR, the EVS person is released, and then we basically end the workflow for that patient. So although the patient has sort of gone elsewhere, we don't actually model that. All right. So what do we collect here? We're collecting the time in the system. That is the time from arrival to completion of the surgery, and we develop a flow time graph for that. And typically there'll be, 5 or 6 or 7 bars in this histogram because that's the number of surgeries completed in a day. The day lasts from something like 7:30 to 6 p.m. And we just simulate a day at a time. Right. So you'll see that these flow times are not identical by any stretch, and they may, in fact, in the base case, get progressively longer as the day wears on, where the early patients sort of like create a log jam, which subsequent patients then face, and they have to sort of wait for maybe multiple patients ahead of them to clear out of the process. All right, so that in essence is one of these tracks. This is the main part of the simulation. The time distributions borrow from information carried in these parameters, which again you will set by having a look at simulation main for simulation main for this one. So here are the parameters. So 90 is the interarrival time for A and B, and so on. The surgical time for process A, for track A is 100.71 mean. Same is true for B in the base case. And we're releasing 6 patients or scheduling 6 patients in each track in the base case. Not clear they're going to all complete. That's something that you'd have to experiment with. All right, so what else? So this information at the top here is an animation. We'll run this just in a minute. And you can see there are 4 basic activities in this workflow. There's the registration, sedation, surgery, and then the cleaning process. And again, we're measuring the time in system from time of arrival to completion of surgery for the patients. There is a penalty on that. The hospital wants to minimize flow times because it's a high risk time for patients, and it's also an anxious time for friends and family. So they figure that for patient well-being and those that are supporting the patient, minimizing that flow time would be a smart move. So it's going to be penalized $50 a minute of flow time for each person. So we'll be able to observe how these patients flow through here, and yeah, and so there's sort of like the pink one here at the end for the cleaning of the OR really is just the EVS people, not the patient, completing there. There's some output here of the utilizations, and but the most important final numbers for each day are shown here, where you've got the surgical count for tracks A and B, the average flow times for tracks A and B, the utilization of the registrar across the day. Same for the anesthesiologists dedicated to track A and B, EVS folks, surgeons dedicated to track A and B, the CRNA pool, the PA pool, and then here are 2 financial metrics: the revenue. So this process, I think they make 22,000 revenue per surgery. And that's going to be, a function of the number of surgeries that are scheduled and actually completed. So surgeries A and B, and then patient penalty is the cost of the flow time. We're going to deduct that from the revenue. So it's a proxy for patient well-being. All right, so let's run this thing and just see how it goes. So when you run this, you want to pick hip-hop version 2 simulation. Not going to spend any time looking at the detail on this, but just observe sort of just the controls on the actual model itself beyond the parameters. So here it comes, and it's busy running. So you can see the first patient is in registration currently in both tracks. I'm going to speed it up just a tad. And we can skip the clock shown here. We're at 15 minutes into the day. So first patient has completed registration, has seized an OR, is now in sedation, being sedated. So that's pre-op prep and sedation. Completed that. Surgery has started. And so you can see the surgeon utilization is now bouncing up because that patient is in surgery. And you can see the anesthesiologist is already rather heavily utilized because that provider had to sedate and then stays on and during the surgery. Okay, so first surgery is not yet done in either track. Let's maybe speed it up just a tad bit more. You can see here are the first patients completing the surgery, and here come the second patients. So they are waiting to get sedated, and they can't get sedated because guess what? Those anesthesiologists are still working the surgery. So as soon as those surgeries complete, the anesthesiologist goes back and sedates the next batch of patient or the next patient. And then, so you can see these patients, the third patients are coming in and they're waiting for sedation because that anesthesiologist is still working these patients here. All right, so the first surgery completed in the flow time was 165 minutes. Track B, it was 151.95. Depends on, just the BMI, nothing else. So now you've got two. You can see the second one was considerably higher, 185. Here it was up to 200. And you can see the anesthesiologists and the ORs are color-coded red. So these are very heavily utilized individuals currently. All right, so we can speed this up manually, but I can also run it to completion, which we'll do. So it runs to 630 minutes. In other words, it's simulating a day. And we completed 4 surgeries in each track. How do I know that? I'm just counting the bars here. And I can also see what the average flow times are. So 207, 205, about the same. And that results in a penalty across both tracks. In other words, both tracks, or almost $25,000, and revenue is 35,000. So this penalty is heavy, and you'd really want to work to try and reduce that flow time. Okay, so what else to notice here? The nice thing about this parameter setup here is that you can see for each run what your settings were. This is the base case. You're getting KPIs here. It's showing you what your count is. It also shows that here, 4 and 4 on both tracks. Here, your flow times. That's that same information repeated here. Your registrars are utilized about 22% of the day. EVS staff about 16.5% of the day. Anesthesiologists, 89.2 and 88.4. Those are high. Surgeon A, 70%. Surgeon B, 56.6%. There are no CRNAs or PAs in this pool right now. They were none assigned. You can confirm that here. No CRNAs, no PAs here. That's an option to add. And these details here on these utilizations are, in fact, summarized here. We don't need to worry. This is, very difficult to read with all the overprinting, but I needed to set up the statistics and then also have these outputs so that we can reference those in the optimization tool. All right, so obviously simulating one day, you could get a bunch of, heavy BMI patients or very light BMI patients, and the day would look completely different. So we'd have to simulate probably 5 or more days to get a good sense and then build averages and confidence intervals off that. So I'm going to redo it. And it did run to 630 on the next day. I got 4 and 4. You can see the flow times differed. So all I do is I hit stop and run. And here I got a 5 versus a 4. So it's not true that you're just going to consistently get 4. Sometimes you could get a 5 and a 5. Run it one more time just to illustrate. And there it is, 4 and 4 again with some very high flow times, 204, 210. Okay, that's the model. In the next clip, we will discuss the detail on the base case, consider how those results look through the lens of the triple bottom line and sort of the initiatives that Hipkins Hospital wants to pursue with regard to keeping the utilizations below burnout red lines.